So I am thrilled to start off today's event by introducing our keynote speaker, Senator Patty Kuderer. You all know her as a representative from the 48th Legislative District, first as a representative, then as a senator, and she is now the Insurance Commissioner-elect for the state of Washington, and we are getting her in this beautiful moment in between her serving in the state Senate and starting her job as the Insurance Commissioner. So please help me welcome Senator Patty Kuderer. All right, well, wow, I feel like I'm on a talk show. This is amazing. So thank you so much, Senator Kuderer, for being here with us today, and we're just honored to have you in this special moment in time. Would love to just start out by getting a little bit into what your motives were for running for Insurance Commissioner.
Well, thank you, and I want to just start by thanking all of you for being here. I know I'm in a room full of experts, and I do not consider myself an expert by any stretch of the imagination. But I do have some lived experiences, both as a trial attorney and as a mom with the healthcare system. And what motivated me to seek this office was healthcare. And it's been called my political origin story, but I can tell you at the time, politics was the last thing on my mind. My daughter was born extremely premature at 1 pound, 13 ounces, 3 months early, so a micropreemie. And she spent 5 months in the NICU, and she had 3 surgeries. And during that time, I was very fortunate. I was managing partner of my firm, and they were like, "We got your back. We're going to pay you. Go be by your baby's side," which is exactly what I needed to, where I needed to be and what I needed to be doing. And so I have to tell you, at that time, I mean, it's so incredibly stressful and you feel so vulnerable, and it's not something you know you're not going to be able to kiss and make it better. So you're really relying on the experts around you to guide the care and to make sure that your baby lives. And my biggest fear at that time was not just that she would die, it's that she would die and I wouldn't be by her side. So when the doctors were ordering treatment for her and they came back and said the healthcare company had denied her care or payment for it, you know, I didn't receive that very well. And sometimes it comes in handy to be a trial lawyer. That would be one of them. And, you know, they ended up paying for her care. But when I went back to the NICU and looked around at the other families who were going through the same thing that I was going through, I had to believe that the same thing was happening to them. Mm. And it really, it flipped a switch in me. I've said this before. I had this realization that we had a morally bankrupt healthcare system. That's what came to my head at the time. And I felt that way because I realized that they were willing to deny care to my baby for the sake of profit, is what it felt like to me. So, you know, when I brought her home at 5 months, and she was still medically fragile and was for many years, there was a letter from the insurance company to add insult to injury telling me that she had nearly reached her lifetime cap.
Wow.
So that, you know, that kind of launched me on this journey to really support universal health care. And when I got into the legislature, I thought, well, now I can do something about it. And it isn't something that you do overnight, and I certainly knew that. And in talking with staff, they said, you know, Senator Kuderer, this really needs to go through the insurance commissioner's office. And that's when I went, you know, I think I kind of want that job. So that is what really brought me to the table, is this passion to make sure that everyone has access to health care, affordable health care, and that, you know, people they're not being denied treatment for the sake of profit. And that is something that I know in the United States of America we say we can't do because we have the system that's evolved. I don't believe that. I think we can change it. And I think if we have the political will and if we have people in the right places, we can make a difference. And I can tell you that I voted for the creation of the Universal Healthcare Commission in Washington State. We intentionally put the insurance commissioner on that commission. I intend to attend, along with Jane Beyer, those meetings and help us move toward a system where everyone has access to healthcare.
Great, and shout out to the Universal Healthcare Commission. Any of those folks out here? Yeah, proud and loud group. How's your daughter doing now?
She's about to graduate law school.
Wow, to become a trial attorney like
She
you?
is, yeah. She wants to go into employment law, which is what I did. So.
Amazing, amazing. Very cool. Well, my next question is, what are your priorities? What types of things are you thinking about as you enter office for 2025, but also beyond?
Well, priorities are going to be, first and foremost, healthcare. As I traveled around the state the last 18 months, talking to people, healthcare came up the number one issue on people's minds, and both in terms of accessibility and affordability. So that is going to remain a priority, and we have staff from the OIC over here that are part of the health policy unit. I'm very fortunate to be walking into a situation where there is an entire office full of incredibly talented, smart, dedicated people who really are there for the public service.
Yeah.
And care very deeply about the mission of the OIC. So that's going to be a priority. Another priority, and of course, I know this is a healthcare conference, but the insurance commissioner does more than healthcare. And second, a close second to what I heard when I went around the state was auto and homeowners. And we're seeing the devastation of wildfires in California right now. We've seen the devastation of wildfires here in our own state. And there is a direct link between the increasing frequency and intensity of these natural disasters and insurance. So we're going to be actively engaged with how do we strengthen whole communities, harden them against natural disasters to help maintain insurability for folks. So that's one thing. Another thing is, I really believe in transparency and accountability. So we're going to be, I'd really like to have a focus on the complaints that we get at the insurance commissioner's office and being, hopefully, being a resource for consumers around the state. So within the healthcare issues that I heard about half of those were Medicare Advantage. And so we have at the OIC, the SHIBA program, which you probably all are aware of, which are their advisors that help people help with Medicare Advantage plans, et cetera. And I want to provide the employees at the OIC, especially in the SHIBA program, the resources that they need in order to be more engaged with the community and helping them find the right plans for them. So I intend to take the show on the road. Going around the state first year and talking to communities about their insurance needs and businesses and organizations and seeing how we can, really fulfill the statutory duty of being a consumer advocate because, we're only one of 11 states that actually elects an insurance commissioner. And in addition to the regulation and oversight function, we do have the job of being a consumer advocate. So I take that very seriously.
Yeah, I was wondering, when you go around and you're campaigning for a job like this, it's not quite as well known as, say, like a senator, right? So I'm curious, did you have to do a lot of explaining about what the insurance commissioner does when you were talking to folks?
I had to explain that we had one. I mean,
yes, exactly.
Most people don't know that we have an insurance commissioner, let alone what the insurance commissioner does. So. Yes, I realized pretty early on in the campaign that that was going to be an issue. So it wasn't just raising my own name recognition and going around and talking to people about why I felt I was the best candidate for the job, but it was also raising the profile of the office itself. And I mean, a lot of people didn't even know that when the people who talked about Medicare Advantage plans, they didn't know we had a SHIBA program. So I really am a big believer in consumer outreach and consumer education, and I think this is going to be an important piece of it.
That's great. And I think that's something Washington generally does really well, is outreach to the community. Well, speaking of outreach, curious if you have any thoughts on increasing coverage. Last night, a number of us were talking about 2010 and about how high the insurance rate was back then. It was in the double digits, and now we've definitely gotten it a lot lower. But of course, there's concerns about keeping that that high coverage rate. Low uninsured rate, and also making things affordable, because as we know, coverage doesn't necessarily mean access. So do you have any thoughts on that?
Yeah, I mean, we need to be addressing it in the immediate term, right? And the Insurance Commissioner's Office did issue a report, many of you have probably read it already, that had recommendations for how to reduce costs in healthcare. And reference-based pricing is now a bill in the legislature, and it's something that we will be supporting in order to help bring those costs down. So, and there are going to be other things we need to look at, but I think we need to have all stakeholders at the table talking about that, and what does that look like, and what can we do. I kind of look at healthcare, we have the emergent issues right away, and then there's sort of the midterm, and then you plan for the long term. So
right.
you have to have a global strategy, and and we will be having a full healthcare strategy going forward to see how we eventually move toward that goal of universal access.
Yeah. Yeah, and we're certainly in an interesting time. We're about 5 years out from the initial COVID case, and Washington State was unfortunately a leader in that, I should say. And I know that we are facing a changing federal landscape, and I'm curious how you are incorporating that into your thinking and building of priorities.
Yeah, that is a really good question, because honestly, I think we have to prepare for the worst. I mean, we've been in this situation before, and we had threats to the ACA in the past and Medicaid funding. We're preparing for that to come back again. Even though I know the new president-elect has recently said that he wasn't going to repeal the ACA now, I'm not exactly going to bank on that. So I'm preparing as if he is going to attempt to do that, and also to pull Medicaid funding or make it into a block grant, something like that. But we have a playbook. The OIC had a playbook from 2016, and I'm sure that's already been pulled out and looked at, and we're going to be updating that for what might be coming down the pipe here.
Yeah, and is that something you heard a lot of concern about when you were on the campaign trail? I know we didn't know the outcome of any of the federal elections at the time you were campaigning, but did you hear a lot from folks about what was going to happen to the ACA when you were talking to people out there?
Not in those terms, but
Right.
I think people were concerned about whether they were going to have health care insurance. So they didn't necessarily say, I'm afraid the ACA is going to be repealed, but they kept talking about the fact that they couldn't afford it, and they can't afford the costs outside of the insurance. In the United States, the number one reason for bankruptcy are medical bills. And that is primarily from people who have medical insurance. And the system isn't working for people or for providers. And I think it really does require us to take a serious look at how we can change the system to make it sure that it's much more patient-friendly and treats providers fairly, and I think is more preventative-based.
Yeah.
I grew up in a family of 9 children, and
wow.
yeah, I learned about abuse of power at a pretty early age, I'm just going to say. We were always taught, you prevent that problem from happening, right? You always prevent it. So I think that our medicine needs to be, and our healthcare system needs to truly be a healthcare system, much more preventative-based. And I'd like to see us move in that direction.
Yeah, we started off this conversation you talking about your daughter being born and your experience with healthcare at that time, and that was, I'm assuming, pre-ACA, especially if she's graduating from law school, you said. So I'm curious, have you had recent experiences as a healthcare consumer when you're in that role? I think that's one of the unique things that makes healthcare really fascinating is our elected officials are constantly having their own interface and interaction with healthcare. Are there things that you've noticed as a consumer that have been troubling to you or interesting over in recent time?
Well, funny you should ask. So right before I got in the legislature, I was involuntarily enrolled in mail order pharmacy. And when I called up and I found out because my drugs came in the mail and I was, wondering how they got there.
Right.
So I called up and they told me that I put myself in mail order, and I have pharmacists in my family, so I know I didn't do that. And they kept insisting that I did, and one thing led to another, and they sent me a letter saying they were sending me to collections. So then they got a letter on my legal letterhead that told them what would happen if they did that. And I asked them for the proof that I'd put myself in mail order. Well, one thing led to another, and they dropped it. But then, as divine intervention, I get appointed to the legislature the next year, and I start looking at that. And I get on the healthcare committee in 2017 and decided that I was going to drop a bill to say that if you want to be in mail order, you have to consent to be in mail order. Seemed pretty obvious to me, but boy, that was a 7-year fight. And this last year, we finally passed major pharmacy benefit manager reform.
Wow.
In our state. My second co-sponsor on that bill was Senator Shelley Short from northeastern Washington, one of the more conservative Republicans in the Senate. We were lockstep on that bill. I like to say we had a Thelma and Louise pact on it because they were really coming to take the consumer protections out of that bill. And if they had done that, we were going to let it go over the cliff. But I can also tell you that we worked very closely with the Office of the Insurance Commissioner, and Jane Beyer and Joyce Bruce were just fabulous on the bill, helping shape the bill and helping us point out, maybe some pitfalls and things we might want to think about. And so for us, it was really a crowning achievement to have its pass with such strong bipartisan support out of both chambers. So that happened.
Yeah.
But I do think, and even I've handled hundreds of insurance-related claims, many of them medical-related claims as a trial attorney on behalf of my clients. And I also know that we have a system. For example, I had a client who was hit by a drunk driver, and his wife was killed, and he was quadriplegic after that accident. And because of the way our system is in Washington, the insurance company was able to delay paying the policy limits, which were a lot, to this individual. And he ended up having to spend down into poverty to qualify for Medicaid. I just think that's morally reprehensible that we have a system that does that. So those are some of the things that, I hope that we can fix. And some of that has to have a fix within the judicial system and our legal system, and some of it needs to be in the healthcare system.
That's great. I love hearing about having a Thelma and Louise pact with Senator Short. It creates quite an image in my head. That spirit of collaboration, I think, is so crucial. And curious, is that something you plan to bring into your role as the insurance commissioner? Do you have thoughts on how you plan on integrating bipartisanship and engagement with different groups and folks who think differently maybe than you?
Oh, absolutely. And just for starters, I'm not afraid to have someone disagree with me, right? I mean, it's, like I said, I grew up in a family of 9. I was compromising before I was out of diapers. And we also, as a lawyer, I have people who disagree with me all the time as well. So it's not something that's foreign to me. I actually like it because it makes me think about my own position and maybe what I need to change in how I'm approaching a problem. And in terms of like universal health care, I'm kind of agnostic on how we get there. But I do think it's important in terms of collaboration. From my standpoint, I'll be meeting with each of the members on both sides of the aisle of the committees that my office will be appearing in front of mostly. I've already indicated to the legislators that we're going to be a resource and a partner with them, but also to the other state agencies and also to the stakeholders. We don't do this work in a vacuum, and the idea is to have a strong, robust, healthy insurance market in all insurance areas, and to have strong consumer advocacy protections, strong consumer protections in the same place. And I don't think that those two things are mutually exclusive at all. I did insurance defense for the first 10 years of my life, meaning that insurance companies asked me to represent their insureds. And so I know that there are good insurance practices out there. And I also know that there are abusive insurance practices out there, and that's what we're going to be looking out for. And I know the companies that do it right, they don't like it when other companies do it wrong either.
Right.
So they would just as soon, everybody play by the same rules, and that's what we're looking for at the OIC. So yeah, there will definitely be collaboration. I want to hold regular stakeholder meetings with folks and hear their concerns, hear their views on bills that are going through the legislature. And we've already started our work on agency request legislation and reaching out. I just had my very first meeting with one of the members of the legislature yesterday. Okay. They know me, but now I'm in a new capacity, so it's a chance to reintroduce myself.
Yeah. Anything you want to preview from that agency request legislation that you want to share with the group, or do we have to do that reading ourselves?
Well, one, I'm sure, is very predictable. It's a major cleanup bill, and this happens every year where there are statutes that maybe are outdated or, work groups that have expired, things like that are still in statute that need to go away. So that's a cleanup. The other one deals with giving restitution authority to the Office of the Insurance Commissioner when there's a violation. Right now, the insurance company has the ability to make the consumer whole, but is not required to. And while the insurance commissioner can request it and ask for it, we don't have any authority to make sure that happens. I consider, giving the OIC the ability to say, yeah, in addition to this resolution for this violation, you're going to reimburse the consumer for their loss. I consider that a lawsuit reducer, a litigation reducer, because right now what happens in cases where insurance companies don't make the consumer whole is they would have to go to court. And I think that's an unnecessary step. They wouldn't need to if we had that authority to say, in addition, just make them whole.
Yeah. Well, you're a few days out from your senatorship, is that right? And a few days before you're starting your new role. Any reflections on your time serving in the state legislature?
Well, it was a deep honor to represent the 48th Legislative District. I was their very first female state senator. And while that
yes, love the clapping. yes, more women in state roles.
Well, I did kind of wonder what took them so long.
Right.
It was really an honor. And I have to say, I'm a big believer in that you're not entitled to a position, that you earn it. Mm-hmm. And every time I went out, I didn't just go out and knock on doors during campaign season. I was out in the community a lot. I was always very active in the community anyway, even when I wasn't thinking about going into the legislature, and you'd be amazed at how much more we have in common than we don't. And I think, when Emily was born and my parents called me, my dad said to me, first words out of his mouth were, "You don't always get to pick your challenges, but you do get to pick how you respond to them." And I think, when I go out and talk to folks at the door and they tell me what's going on, I try to, first of all, I think it's really important to be a listener, and then to help them process what they think might be a solution as you work together to try and solve these problems. But I do think that collaboration typically makes the best solutions. and I'm a natural-born problem solver. So I think there's always a way to solve that problem.
Yeah, definitely believe in collaboration, and isn't it what they say about compromise, that everyone leaves unhappy, but you move forward just a little bit. Anything else you want to share with this group before we move on to the rest of our day?
Well, I just would like to say that I know that when I started out, I said, I know you're all experts, and I know you are. And if there's something, an issue, a problem, a solution that you think that we need to know about at the Office of the Insurance Commissioner, please reach out to us. I had an open door policy as a legislator, and I want to maintain having an open door policy at the OIC. So I want to thank you all for your time. And Catherine, thank you very much for this. I appreciate it.
Yeah, we really appreciate you being here. Yes, one more round of applause.